All right, I have Gabrey here, who is a therapist. Hi, Gabrey.
Hello.
How you doing?
I'm good. How are you?
Doing good. Are you ready for the amount of questions I'm going to drill you with?
I think I can handle it. I hope so.
So I asked Gabrey to come on to talk about therapy, and I thought of a bunch of questions that I thought other people might have about it. So the first question I have is, does everyone have trauma, and what is it?
Good question. Um, I think the kind of trauma that we diagnose, maybe not everybody holds, but I think we all have some kind of trauma to work through and sometimes work around. And trauma is something that gets in the way of you being able to function in some kind of way. And it might just be something that causes you to pause before you actually do what you need to do. And sometimes it completely shuts you down. And it's usually a trigger, something that reminds you of an event that really was traumatic and upsetting in the past. And you connect to that viscerally in your body. And depending on how strong it is, it can interrupt or completely stop your ability to move forward in things. So what I see a lot is people just can't absorb or engage in conflict. And so they either explode really quickly because it just, there's no tolerance, or they just shut it down and either go along and get along always, or just run away from any opportunity for conflict. So those are just a couple of examples of how it shows up. But it's definitely something I think we all experience on some level.
Okay, so my next question is doing therapeutic things like making music, watching movies, drawing, or cleaning or cooking, is that the same thing as like receiving benefits from therapy?
It's kind of like the difference between covering a wound and actually treating the wound. There's reason for covering a wound, and there is benefit to like just kind of soothing yourself and calming yourself in a particular moment, or giving yourself some space to breathe or feel. Covering the wound is good too. But actually treating it, whether it's therapy or doing therapeutic things like being creative, I think is a different thing than consuming creativity. Uh, they both have their benefits and joys, but when you're actually processing through some of the feelings or trauma you've had to make art, or to not even make art, just write in your journal and really feel it, I think you're conducting a form of self-therapy. And it just depends on what level of care you need to figure out if you need support beyond that.
That makes perfect sense. I love that so much, covering a wound or treating it. And both have their value. They kind of need to work as a function, it sounds like.
Yeah, and you're gonna just keep having to cover it up if you don't ever fully process and treat it.
That's amazing. Yeah, I'm going to use that. That's a really, really good analogy. So the general presentation of therapy is that you sit down and you talk endlessly without kind of a real direction. And I know that's not the case for a lot of the modalities in therapy. Can you explain like some of the ways that you participate in a therapy session and give examples maybe?
I'm probably closest to that that standard model that people think, which is called more psychodynamic and dealing with unconscious. It's letting people express, and then pulling threads and trying to tie threads together for people, help them see connections that maybe they wouldn't see on their own. There are definitely more directive therapies. One of the biggest ones is called cognitive behavioral therapy, or CBT. And so that's really more structured and regimented, and has a real process to it that pretty much every therapist follows that goes through that modality. And that's really training yourself to rethink thoughts. If you think about something in a negative way, it's training you to recognize when you do that and reprogram yourself to think in a more positive way. And it can get deeper than that in terms of what you're trying to retrain. And so there's that therapy, and there's psychodynamic, and they're usually the two poles that people talk about in our world. But there's a lot in between that takes pieces of each. And then there are ones that are more somatic. So really getting people to really feel their emotions and their traumas in their body. Some of those therapies actually, do body work and put hands on you, or get you to really work with your body and feel it out. Um, there's narrative therapy, there's feminist therapy, there's multicultural therapy, there's all these different modalities. It's important where your therapist is coming from in terms of modality, but all the research shows the most important thing is the connection you build with that therapist.
Got it.
So if their modality is totally different from what you're looking for, that probably will have something to do with your relationship too. You find someone that sounds like they do the kind of work you want to do, but it's not feeling right. Listen to that. Now, being uncomfortable with a therapist may not mean that that's not the right match for you. That could be someone who's challenging you and trying to pull things out of you that nobody else has really tried to pull before. So you really got to check in with yourself and decide whether discomfort is the same as not having a connection. But that is the most important thing to really look for. Some people have been challenged their whole life and or have been kind of pushed and prodded a lot. And so they really just need a comforting presence. And so that kind of therapy is effective too. Somebody that's just really sits with you and feels like a big comfortable blanket that you need to cover you.
Got it. So connection first, and then observe things from that point.
Yeah, and observe yourself.
Yeah, it sounds like a lot of trial and error and being patient with that process.
Yeah.
It's like anything else that's like a big decision in your life. I think having a person that you choose that's gonna be by your side to hear your deepest, darkest everything's. You can't just like pick them just off the cuff and hope it works out and then get upset when it doesn't. It's like a job interview. It's like you really are going in and finding this person that you feel like is going to fit. People think of going to therapy when stuff hits the fan. Do you think therapy should be considered only during that time?
No, absolutely not. I think people of means always knew that having some support along the way, even when things are going well, can be helpful. And personal growth is always a worthwhile thing to do if you can, and you can kind of maybe avoid stuff hitting the fan more often if you have an opportunity to sit for an hour and reflect on what's going on in your life and maybe see those things coming from a mile away instead of from 10 feet away. I think that's something that we've all maybe experienced a little bit, is being able to sit down and have a little bit more perspective.
Right.
In this time that we can do as much as we used to do. So I think that's true when you can actually just carve that out. That's what I tell people when they want me to describe what therapy is. I just say it's an hour that's yours, and someone sitting focused on what you want to focus on and deal with. That's what it should be all about.
Yeah, amen. Amen to that. And I don't know anyone that doesn't mean that. Okay. All right. A lot of people can't afford therapy. They don't have insurance. Like, what can you suggest to those people that are still looking for some guidance?
Well, there are more options probably than people realize. There are clinics, therapists before they get enough hours or pass all the licensing tests, they're pre-licensed therapists. And so they've got to be under the supervision of somebody that's licensed or an agency overall that's licensed. A lot of clinics offer either, usually not free, but sometimes free, but a lot of times sliding scale. And it's really based off of what you can afford. And we're talking about, instead of paying $220 an hour, you're paying 35 or 50 or something, based on how much you can afford. Most major communities have at least a few of those clinics because therapists need to get trained, and you're getting really good care because all of those pre-licensed therapists are getting supervision. And so whether it's weekly or bi-weekly, they're talking generally about their cases and getting support from really experienced people on how to assist in that therapy. So you're not getting sold short if you're going down that road. And then there's group therapy. That's always a lot less expensive than just signing up for individual therapy. I have a Black men's group. You can find one that's all women. You can find one that's just general group therapy. So it can be a mix of a bunch of different kinds of people. So that's another way of working in group therapy. The research shows that's just as effective as individual therapy. Just Google low-cost therapy in my area, or If you're looking for a specific type of therapist, Latinx therapist or Native American therapist, then you can find those directories that are really plugged into the community you're trying to find.
What would you say to the people that are afraid to potentially get a diagnosis that they don't want to receive?
A, I understand that feeling, and B, it's the same as getting a physical diagnosis. It could be crushing and feel terrible to hear you have cancer or some other disease, but then you're able to respond to that and fight that and have a better opportunity for getting well than pretending nothing's wrong
Yeah.
and letting it just consume you. And that's the same with a mental illness as well. So many people live great lives and they live with that mental illness. And that's the number one thing is you're not defined by that mental illness. You're defined by who you are beyond that. And just for example, get diagnosed with bipolar disorder, there may be certain things that you avoid to not be triggered in one way or the other. There may be a medication regimen that you need to stay on top of. But those things are all not to lock you down, but really to free you.
Right.
You can live the rest of your life without this just jumping in on you and taking over for a period of time.
Right. Not to mention the release of the fear of wondering.
Mm-hmm.
If you suspect that maybe a diagnosis is necessary, then I can't imagine living with that. And anytime I got triggered or something like that, being worried about, oh, is this, and then self-diagnosing on the internet, which we all know is the worst thing that you could ever do.
Worst case scenario.
Yeah, exactly. Just like facing it and saying, okay, what is this, and what can I do to manage it?
Because you pretend like you're not afraid if you ignore it, but you're really just putting it away somewhere where it's just festering. That fear is just festering.
When you put it away and you try to sit on top of it, it grows exponentially, I feel like. And it comes into it's like always the baseline of all your life experiences. If you're laughing, it's in the back of your head. If you're crying, it's in the back of your head. If you're hanging out with friends, it's in the back of your head. It's just like free yourself.
It could be something a lot simpler than you think it is.
Yeah, exactly.